everyone, so let's move towards our today's topic, which is
that is vitamin D. Now basically vitamin D controls the calcium and phosphate level in the blood. It like parathyroid hormone, vitamin D also controls the calcium level and phosphate level in the blood. Now vitamin D, how it will perform the function, how it works, it performs its function. So what happened basically, आपने अक्सर सुना होगा कि भाई सूरज की रोशनी लेनी चाहिए, आपकी हेल्थ के लिए अच्छी होती है. सो वाई? बिकॉज ऑफ विटामिन डी सिंथेसिस. बेसिकली व्हाट हैपेंस ड्यू टू द अल्ट्रावायलेट रेज फ्रॉम द सन इन द स्किन, a structure is formed, basically cholecalciferol is formed in the skin, and that cholecalciferol, which is also known as vitamin D3, so that will go into the liver, and it will convert it into 25 hydroxy cholecalciferol, and that 25 hydroxycalciferol will be stored in the liver, and when it will need it, then that 25 hydroxycalciferol goes into the kidney, where it further converted into 1-25 dihydroxycalciferol, which causes calcium level, due to which there will be increased amount of calcium in the blood. So you have to remember this point, that this synthesis के कैसे होता है. स्किन से cholecalciferol बनता है जो लिवर में जाता है, फिर वो किडनी में जाता है, और फिर जब वो किडनी में जाता है देन वो कैल्शियम लेवल को इंक्रीज़ करता है. नाउ वन मोर पॉइंट, दैट इन द किडनी parathyroid hormone will act on that 25 cholecalciferol, due to which it will be converted into 1-25 dihydroxycholecalciferol. What are the effects of vitamin D? It is very simple, that it will increase the phosphate and calcium level in intestine, and in kidney it will decrease the calcium and phosphate level. So this was the whole topic regarding vitamin D, which is very much important. Till then, work hard, study hard, and good luck. Bye bye. Thank you.